In 1857, a passage from Almanac of Children's Songs and Games from Switzerland warned that the child will soon die whose forehead tastes salty when kissed. Paul Descent revealed the increased salt content of sweat in people with cystic fibrosis. In 1964, cystic fibrosis was narrowed down to chromosome 7. This helped doctors identify the specific gene responsible for cystic fibrosis. Dr. Dorothy Anderson was the first physician to recognize it as a disease and create tests to diagnose it. Cystic fibrosis causes the production of abnormally thick mucus, leading to the blockage of pancreatic ducts, intestines, and bronchi, often resulting in respiratory infection. Cyst is a sac containing fluid, in this case, the mucus. Fibrosis is scarring of the tissue. Cystic fibrosis is basically thick mucus that builds up in your lungs and blocks your airways. The buildup of mucus makes it easy for bacteria to grow. This leads to a lot of lung infections and over time damages your lungs. It also blocks your tubes in your pancreas. As a result, the digestive enzymes can't reach your small intestine. These help break down your food. Without them, your intestines can't absorb fats and protein. This can cause vitamin deficiency. You can lose a lot of salt in your body. This disorder is a mutation of the gene that codes for cystic fibrosis. It's also a recessive disorder, which means both parents must pass on the gene for the child to have it. If the child has a copy of the gene, he or she will be the carrier. Carriers don't have the disease, but they can pass it on. A blood test is taken to look for the gene that causes it, and a sweat chloride test for high salt levels in patients' sweat. Antibiotics to prevent lung and sinus infections that is taken by mouth or in your veins. Inhaled medicines to open airways. Vest treatments shake your upper body to loosen mucus, making it easier to cough up. And lastly, lung transplants, which are only in some cases.
So here are some of the medications that I do on a daily basis. I have some puffers that I take. Here's a saline that I flush my nose out with. And some pills, I keep in pill boxes because there's so many, it's hard to keep track of them. And then this is one of my breathing treatment machines, and I put my medication in it and it aerosolizes it, so I breathe in the medication into my lungs. And I strap on this vest twice a day, and it inflates and vibrates at different frequencies to loosen up the mucus and get it out of my lungs. And the vest vibrates and helps loosen up the mucus. When I wake up, I go sit in my machine chair and I do the IPD machine. It's like, it percusses like through a nebulizer. I've had to be in the hospital like every other month. Like, I'll be out a month, and then I'll come in for 2 weeks, and then I'll be out 2 months, and then I'll come in for 2 weeks. I've actually never been in a situation where I've had to consider a lung transplant. It really is a very extensive procedure that sometimes makes the patients worse than when they came in. There's only a 50% chance that a patient who has received a lung transplant will live for 5 years.
They talked to him about a lung transplant lots of times, but he never wanted it because friends of his that did have it, they still passed away. He didn't want to go through everything that you have to go through with the lung transplant and still die.
I was 28 years old when I had the transplant.
I definitely need a lung transplant, like soon.
Up until that time, life was getting to be really a struggle. And it's amazing how that donor just came in, honestly, at the nick of time.
My lung functions are probably like almost non-existent. I'm near the end. There's not much, like my lungs, there's just not much left.
With having the transplant, I've traded one set of problems for a different set. The transplant's been a nice solution. A cure would have given me a better life.
Avoid smoke, dust, dirt, fumes, chemicals, mold, and mildew. Drink plenty of fluids. Exercise 2 or 3 times a week, and clearing or bringing up mucus 1 to 4 times a day would help. Unfortunately, there is no cure, but a group of parents started the CF Foundation in 1955 to create new treatments and find a cure. Researchers from molecular biology, immunology, and medical chemistry are trying to figure out a new strategy to tackle the disease. In the 1950s, few children lived to attend elementary school. Now the life expectancy is 30 to 40.
I think my biggest fear in life is the same as most people's. It'd be death, like the end. Or like, dying alone, like never getting married, never having like that one person or whatever.
And I'm scared that I won't be around for long enough to raise my children, and I won't be able to have a normal job because I need so many accommodations because I'm sick so much.
My dreams are to make sure that I am healthy enough and strong enough so that my daughter, who's 3.5, will grow up to a point and be able to describe me and know me.
My biggest fear in life is to have my daughter die before I do.
We thought we would be prepared, but you're never prepared. We're still dealing with it.
More than 10 million Americans carry the CF gene and don't know it. About 2,500 babies are born with CF in the US each year. Both parents must pass on the gene for the child to have it.
Today is my 21st birthday. The doctors told my parents that it was really unlikely that I would live to be an adult. Today is a really big deal because I'm beating the odds and proving the prognosis wrong. I feel like I have a lot of support and there's a lot of hope for the future.
I think the one thing that I've always described cystic fibrosis is a curse of a blessing. It's a curse for the obvious, for the sickness and the hospitalizations and not feeling well and not having a lot of energy. But in a sense, it's somewhat of a blessing because when you have something like this, you embrace life so much more.
Yeah, I think I appreciate life a bit more, especially more than people my age, like people in their 20s. I think I feel a lot that way, definitely because of the CF.
One of the things I learned from Larry is life is too short to worry about little things. They might seem like they matter a lot, but in the end they really don't.
My one wish would just have to be to get the new lungs and that it goes well and that I can travel after and use my degree and stuff like that.
What I fight for is just one more day. I'm just looking at every day as a gift.
Every single time I've wished on a birthday cake or in a well, I've wished for the same thing. And I'm sure it's the same wish as every other child and young adult with cystic fibrosis. And that is that one day there will be a cure and we will be able to live long and full lives.